Creating and billing an unsuccessful follow-up survey. In this video, we will cover the standard process for administering an unsuccessful follow-up. These instructions apply to an IDJC or DHW non-ATR client who has successfully signed the informed consent and you are not able to make contact with the client. We will also cover creating the follow-up itself and billing an unsuccessful follow-up. In the event of a client who has died, is incarcerated, or has transferred agencies, please refer to the follow-up FAQ and additional documentation provided on wits.idaho.gov. Remember, clients must sign an informed consent specific to outcome data collection. This document can be found on wits.idaho.gov under WITS Forms. Do not complete a follow-up for an ATR-funded client, and an authorization is not required to bill for the follow-up survey. An unsuccessful follow-up can be billed after 4 separate attempts to contact the client on separate days that are documented in WITS by completing 4 individual follow-up activities. To create and bill an unsuccessful follow-up survey, complete the following steps. Click Client List on the left-hand navigation pane to generate the client search screen. Search for the desired client. Once the client appears under your client list results, hover over the pencil icon and select Activity List. WITS will take you to the episode list where you will want to hover over the pencil icon next to the episode of care that requires a follow-up survey. Click Review to enter the episode of care. Once on the client activity list, click Follow-up on the left-hand navigation pane. At this time, if you have additional contact information for the client or their collateral contacts, add the information as applicable. Click Add New Annual Update Record when you are ready to complete the follow-up survey. Select the follow-up type. Update the county of residence. Select a follow-up status from the drop-down menu that indicates why the follow-up survey was not completed. Unable to follow up, awaiting response. This is the selection that should be chosen if you intend to continue to attempt the follow-up completion on another day. Unable to follow up, incarcerated. Please refer to the FAQ and supplemental documentation regarding this client status. Unable to follow up, transferred. Please refer to the FAQ and supplemental documentation regarding this client status. Unable to follow up, unable to contact. This selection should be used as the status of the final and 4th follow-up attempt. Select Unable to follow up, unable to contact after 3 previous attempts have been made. Enter in the date the follow-up was conducted, the number of mail-out attempts, number of telephone attempts, and number of face-to-face attempts, if applicable. Only the first screen of the follow-up is required for an unsuccessful attempt. Click Save and Finish. You will create 4 unsuccessful follow-ups. Each contact attempt must be conducted on separate days. Documentation for each attempt will be recorded on the activity list as a follow-up attempt in a completed status. After completing 3 follow-up attempts, enter your 4th unsuccessful follow-up attempt. From the activity list, select Follow-up on the blue navigation pane. Click Add New Annual Update Record when you are ready to enter the final follow-up survey. Select the follow-up type. Update the county of residence. Select the follow-up status of Unable to follow up, unable to contact. Enter in the date the follow-up was conducted, the number of mail-out attempts, number of telephone attempts, and number of face-to-face attempts, if applicable. Click Save and Finish. Once the 4th unsuccessful follow-up attempt is complete and contains the status of Unable to follow up, unable to contact, you may proceed to bill for the unsuccessful attempts, as WITS will automatically open the intake and create the follow-up program enrollment. If you bill for an unsuccessful 30-day follow-up, you are not required to complete the 6 or 12-month follow-ups for the client. If you bill for an unsuccessful 6-month follow-up, you are not required to complete the 12-month follow-up for the client. Create a client group enrollment. When ready to bill for the unsuccessful attempts, you will need to create a client group enrollment. From the blue navigation pane, click Client Profile and Client Group Enrollment. Click Add Government Contract Enrollment. Select the contract that starts with the funder for the client followed by your agency name. Select DHW Follow-up or IDJC Follow-up as the plan group. Enter the day you completed the 4th follow-up attempt as the start and end date. Click Save. Billing for unsuccessful follow-up survey attempts. Click Activity List and Encounters on the blue navigation pane. Click Add Encounter. Complete the following. Select Follow-up as the note type. Select the service of Follow-up 30-day attempts unsuccessful, Follow-up 6-month attempts unsuccessful, or Follow-up 12-month attempts unsuccessful, depending on what time frame you are unable to contact the client in. Select the follow-up program if it is not already pre-populated for you on the encounter. Enter the start date. Select the service location. Enter 1 for the number of service units or sessions. Click Save and the next arrow. Enter a note in the Unsigned Notes section. In this section, document the 4 methods used to attempt to contact the client. Click Sign Note. Click Save. Click Release to Billing. When the encounter releases to billing, WITS will prompt you to close the case or intake. Select Yes when prompted to close the case. WITS will automatically close the follow-up program enrollment when the intake is closed. This concludes the guidance for creating and billing an unsuccessful follow-up survey. To view information on billing successful survey attempts or other guidance, please review wits.idaho.gov or contact the WITS Help Desk. For questions about the follow-up standards, contact Dan Greenleaf at the Idaho Department of Health and Welfare at 208-334-6681 or by email at greenled@dhw.idaho.gov. For questions about the follow-up survey's functionality in WITS, feel free to contact the WITS Help Desk at 208-332-7316 or by email at dbhwitshd@dhw.idaho.gov.